Good afternoon, good morning, everyone. Bonjour à toutes et à tous. Today, I'm very pleased to share with you my annual report on the state of public health in Canada. It was tabled this morning in Parliament by Minister Hajdu and is called From Risk to Resilience, an Equity Approach to COVID-19. I deliver an annual report on the state of public health in Canada every fall as a requirement of my role. At every press conference, I report on the latest COVID-19 cases so Canadians can better understand the scale and trajectory of the pandemic in our country. While statistics are important, we must not forget that behind each number is a person. That person may be an elder and have health conditions and living in a long-term care home, or is someone struggling to make ends meet, or is someone living with homelessness. Others have lost their jobs or are on the front lines, putting them at direct risk of infection. These are people that have been disproportionately impacted by this pandemic, and through my annual report, I'm shedding a light on the inequities too many people have and continue to face. The impacts of COVID-19 in this country have been worsened by systems that stigmatize populations through racism, ageism, sexism, and others who have been marginalized through structural or social factors such as homelessness. Reports from around the world show there is a real difference in who gets COVID-19 and how severe their illness is. These differences are not random, but fall along the lines of populations that have historically experienced health and social inequities. The fact is that the impact of COVID-19 is influenced by factors such as income, the type of work we do, how many people we live with, and if we depend on someone else for our day-to-day living. The impacts have been worse for some groups, such as seniors, workers who provide essential services, such as those in healthcare or agriculture, racialized populations, people living with disabilities, and women. The virus didn't create new inequities in our society, it exposed them and underscored the impact of our social policies on our health status. Another major consequence of the pandemic is the opioid crisis, with overdoses and deaths again on the rise. There are indications that the street drug supply of opioids has grown more unpredictable and toxic due to the pre-pandemic supply chains being disrupted by travel restrictions and border measures. These findings are more than just uncomfortable facts about our country during this pandemic. They are the lived realities of countless Canadians. In conclusion, I want to say that we have seen tremendous commitment and leadership across Canadian society, from governments, businesses, and civil society. Going forward, we need to focus on three key areas. We need to sustain the collaborative leadership that has been tremendous during the response to ensure that health, social, and economic sectors work together to protect Canadians from pandemics and reduce inequities. We need to continue to build social cohesion. Public health leaders, policymakers, and media need to demonstrate that we're all willing to work together to share information, stories of success, and collaboration towards the goal of getting through this crisis. Only then will Canadians be able to trust credible information and make the daily choices necessary to prevent transmission and protect those at higher risk. Lastly, we need to strengthen the capacity of the public health system so that it can surge during emergencies, partner with other sectors, and leverage the science from academics and universities while maintaining critical work like reducing opioid-related deaths. By working together to address the inequities that underpin our society, we'll move from risk to resilience and build a better, healthier society for all Canadians, now and beyond COVID-19. My bottom line is, no one is protected until everyone is protected. Thank you.